On the 23rd January this year, the 30-year-old Tabisa Nshemerere died while giving birth at Kyegegwa Center 4. Initial reports indicate that her death resulted from negligence by health workers here. When information about her death reached the president, he directed the minister Robinah Nabbanja to look into the matter. Some of the Kyegegwa district leaders accused health workers of demanding for bribes before attending to patients, which had resulted into a number of poor people dying.
They ask money abantu abayizire kuzara.
Basaba sente zokugula ebintu ebyali bitaroho.
Those allegations are there.
However, the officer in charge of Kyegegwa Health Center 4, Dr. Martin Yefta, explained why Nshemerere died in labor.
The baby was already outside the uterus, and that was ruptured uterus. I got the baby out. I did what I'm supposed to do, close the abdomen. But before we could get blood, because in this region we are told blood should be only, there was lack of blood in the region. So before we got blood, at around exactly 20 hours, that mother took the last breath.
Usually when the rupture happens, there is bleeding which is inside.
These people who are dying here are Ugandans. Are we together members? Tukubasaba mumanyire kyokwa tari omwana. Borano urobusawo tukiyayenda kusinga kuita abantu ba Ruhanga akiri oleka.
Nabbanja also issued a directive to all medical workers in government facilities to always be in uniforms while on duty or risk losing their jobs. She added that this would assist patients to identify health workers.
I now want to say, if you don't put on a uniform, it's like you are saying bye-bye to the profession. A uniform is a must. With effect from today, not only Kyegegwa, but all health centers in the country. The patient can even be deceived by an outsider that she's a nurse, when she actually says she's what? She's not. The bribery claims could be because of that. Somebody comes here, camouflages, she's a nurse. In the end, she's harvesting money from our people and extorting.
We even got a cleaner who charged the patient 400. That is going to buy things.
She also advised Ugandans to confiscate branded government drugs found in private clinics.
Why do you go to the clinic and they sell you that drug? That is your drug. Are we together? Okugenda omu clinic oba drug shop okulora alowa kagambo government of Uganda naiwe no sasura. Eri ukwata teka musa otambura. I'm waging war against theft of drugs from Kyegegwa.
Nabbanja further advised Ugandans to stay away from traveling to China to avoid contracting coronavirus disease. She said even after government warned Ugandans to avoid traveling to China, many are still applying for visas to do business in China. Nabbanja says this puts Uganda at risk.
However, yesterday I became a little skeptical because the ambassador said his office was full of over 200 people who were looking for visas to go to China at the expense of our lives. If China, a second biggest economy in the world, is failing to manage this, if it came in Uganda, can we manage?
The people of Kyegegwa are still demanding for their health facility to be elevated to a hospital promised by the president in 2016.
Actually, it is a thorn in our feet.
The health center has just one doctor who is required to attend to 800,000 people. Jingo Francis, NTV.